and welcome to Your Health Matters. You're watching Sun 20 TV, and I'm Shari Einhorn. Thanks so much for joining us. We have a great show for you today. Our topic is inflammation. Joining me as our first guest today, Sarah Lu-Otero, who practices traditional Chinese medicine. Sarah, thanks so much for joining us.
Thank you for having me.
So my understanding, you focus on chronic pain management, rehab from injuries, stress management, and women's health.
That's correct.
Yes? Okay, so why don't we start with, what is traditional Chinese medicine?
Traditional Chinese medicine was actually developed over 2,500 years ago, and I practice in particular acupuncture at Stony, Brook, Southampton. So acupuncture works because it's proprioceptive. Proprioception means that you have a sense of your awareness of your body and space. Now, acupuncture, when you insert a fine needle along a certain pathway in the body, you get to have your brain be like, oh, hi, let me pay some attention to that area. And it can help upregulate certain areas, maybe that were numb or not feeling well, or divert blood circulation to those areas, or downregulate other areas that were too painful.
I have seen acupuncture done. I have never experienced it. Can you give people a general understanding? What kind of needles are used? Does it hurt? What kind of pain is it?
I think that's the most common question.
I'm sure it is.
And it's so funny, I'm not gonna lie to you, it does hurt sometimes,
Okay.
but it only lasts for about 3 to 5 seconds and it should dissipate. I particularly myself am extremely needle sensitive, so when I needle someone, I actually use my free hand and I distract them with pressure and I put the needles in, and oftentimes people tell me that they don't even feel it. But you do feel it momentarily, because when it pierces through the dermis level of the skin, it does pass through some pain receptors.
They're very thin needles from what I've seen.
They're very thin, and I like to buy the thinnest gauge available for my patients because of how my own pain response is. And actually, these needles can be as fine as a strand of hair.
Oh, wow. Okay. And so talk to me about the goal of acupuncture related to inflammation.
Yeah, so inflammation is actually a normal physiological process. It's not all bad, as people mention it to be, but when it's chronic and happens over a long time, it can be very damaging. So acupuncture, when it's inserted into the skin, can go along certain pathways, which we call meridians, which actually have a lot of correlation to Western pathways like dermatomes. Now, inflammation can be, the root of the word inflammation is actually inflammare, from the Latin word, and that means heat, fire, to set on fire, to ignite. So acupuncture, because you're kind of like venting the skin with needles, you're piercing it, you're actually venting out some of that heat, some of those stagnant energies.
So how do you choose what pathway to use as far as the needles?
That's a great question. So our bodies have a bunch of pathways that kind of run like latitude and longitude all over the body, like you would see on a globe. And certain pathways have different energetics. So some pathways may be running along the spine, so that I would use to treat someone with like maybe a herniated disc. Other pathways have different emotional energetics too. So if someone's coming in with a mental emotional issue of anxiety or stress, I would use a different pathway.
Is acupuncture a quick fix? Do I feel relief immediately?
Yes and no. You should feel relief after at least one session, but think about how long it takes for someone to actually develop a chronic illness or disease. People come in with maybe a baseball injury that happened when they were 16 in school, and that can't be fixed overnight or can't be addressed, but really we address both the root and branch of the situation and work together with the patient in order to go to recovery.
How long do the needles stay in for, and are they stationary once you put them in? I think that's something maybe people want to know.
Yeah, it depends. Usually I retain the needles for about 30 minutes because that leaves some time for getting to know the patient, talking to them, taking their health history, and also I do some movement assessment too, and I'm a little bit unique in that way. So I usually retain the needles for 30 minutes, and they usually stay stationary. Sometimes I use electroacupuncture, so that's when you hook up leads of electricity and deliver microcurrents through the needles to the patient's skin. That's very, very effective. And then also other needles, you'll just go in and out like very quickly. It just depends on the intention and the treatment goal.
The I don't want to screw up the name, the
Electroacupuncture.
electroacupuncture, what specifically would that be used for that traditional acupuncture doesn't work on, maybe?
I have found considerable success with electroacupuncture for back pain. This can be back pain that is discogenic, so coming from the spine, coming from the center of the body. That could be a herniated disc. That could be someone who suffered a car accident. Electroacupuncture is also very good for people who are post-stroke. You can use it along the scalp lines too. So it's very, very stimulating.
What kinds of patients come for acupuncture?
All kinds. I would say anyone from pediatrics, although you would use less needles and more just gentle manual work, to people, to older adults. And I like to say it's never too late to start your healing journey, and it's great for anyone.
How do you use acupuncture in connection with, let's call it Western medicine? Do people do both?
I love it. I think it's the only way going forward. It's the future. Integrative medicine is the future. So essentially, if someone's coming to me, like I have a patient, I may have patients who are coming to me and they're going through chemotherapy. And there's a lot of side effects to chemotherapy, even though it is a life-saving intervention. So I work with these patients on decreasing those side effects so that they can restore some semblance of their quality of life back. Also for people who are just on regular medications, these medications may be managing their blood pressure, their diabetes, but they may have undesirable side effects, and we work together to mitigate those adverse effects.
Is there a rough estimate you can give us on how many acupuncture treatments before somebody would stop coming, or is it I come when I feel like I need it kind of a thing?
Both and both. So I have never been one of those acupuncturists to like sell a package of treatments, because that gives some sort of idea and expectation of how long it should take. Really, there is no answer there, and people are layered. They're like onions. Like when you cut an onion, you have to take that outside peel off. Once you uncover one thing, then that might clear up. Then you see something else that was hiding underneath. So I'm not saying you come to me forever either. What I like to do is I like to give patients corrective exercises and lifestyle changes in between each treatment, so that they're not dependent on coming into me, and that they have tools going forward to maintain their health.
And how do patients find you? Is it a referral? Do you find it's most often a referral, or have they tried Western medicine specifically? Let's talk, for the inflammation, and it's not working, and or are they tired of like taking a pill?
Yeah. Personally, it's more word of mouth for me, or just online Googling. But I would say in general for acupuncturists, we are probably like the 15th practitioner that a person sees. It's like often a last resort. People are just so tired of either being in pain, having digestive issues, not feeling good. And then that's kind of, they do all their researching. But we also get referrals from medical doctors as well.
Can you give us some idea of where inflammation occurs most in the body, or what you see in your practice? And, is there some area that is the most common for inflammation?
Yeah, so going back to the root of inflammation, meaning heat or to be on fire, you can see that manifest in certain areas. So someone could have like a low-grade sore throat constantly, or maybe just swollen joint, like maybe they sprained their ankle 3 months ago and it's still swollen and still a little bit red and just has not healed. Other areas you can see that are more affected by what we call dampness. Now, dampness is kind of like when you leave that wet kitchen sponge on your kitchen counter, and that thing just never dries out.
Right, ever. Right.
Ever. And then you just have to throw it away. But we don't want to throw our bodies away, so we have to kind of get rid of that. So that can happen inside of our bodies too. That can manifest as arthritis, pain in the joints. It can manifest as feeling slow and sluggish in the head, like fogginess. It can be digestive issues, like being either too constipated or having loose stools all the time. And it can also mean, like in the case of a back injury, like a constant neuritis of like the disc being inflamed, and then that nerve root being inflamed because the herniated disc is pushing out onto the nerve root and inflaming all of the dermatomes that are associated with it. So all the nerve pathways.
It's fascinating to go back, sort of a question is that you're saying acupuncturists are often like the 15th practitioner that people are seeing. So what are some of the, without violating any patient confidentiality, what are some of the reasons that people have given you that they finally decided to try this?
Mm-hmm. I think it's a frustration. I think it's a frustration with their status quo. Just being kind of like seeing that lab work is relatively normal, nothing jumping out too much anywhere, but then so people are not able to really receive a diagnosis and not able to therefore get a treatment. So in Chinese medicine, we have our own system of diagnosis, which is more of a pattern diagnosis. And in that case, we're often able to catch things subclinically too. So before, in the Western medical model, you often have treatments that are targeted towards illness only when illness happens.
Right.
The acupuncture can be, if used correctly, more preventative.
And so after people have come to you, after they've maybe tried everything else, and they see results, what is their reaction to you? Like, oh, I wish I should have done it. I should have done it sooner. Do you get that?
I hear that all the time, and I firmly believe that we're all meant to be, the timing for what we're doing is all perfect. So there is no too late, but I do hear that a lot. I've heard that with patients who have maybe been in car accidents 2 years ago and are still in pain. And, you know, it is sad to hear that people have to endure this, but also I think people have to be ready for it. You can't force anyone to come to acupuncture or any other healing modality in that sense.
What do you like about what you do?
This is my calling. I love everything about it. I love the fact that I get to listen to people and hear their life stories. Like, I am endlessly fascinated by people. I'm a former social worker as well. I have a master's in social work. So this is a natural extension of that, but now I get to actually use my hands and practice in a different way. But I just love learning how people work, how they function, and then seeing them as a puzzle to kind of solve and address and evaluate their movement patterns, their lifestyles, and just kind of see how we can make small modifications to allow them to achieve their goals. I actually have patients who come in who come to me with life goals. Like, one patient wanted to take a big international trip, and she had planned it a year in advance, but the only thing that was prohibiting her was a very wacky menstrual cycle, all over the place, very unpredictable, and just very painful. So we worked together for a year to be able to regulate her menstrual cycle, and also work together with her Western medical doctor too, to get her the procedures that she needed. And then she was just able to go on that trip.
Oh, that's fantastic.
And she sent me pictures of giraffes and elephants on this trip. And that, I think, is what I love about what I do.
Great. That's so rewarding. Thank you. Sarah Lu-Otero, thank you so much for joining us. Lots of really great information. And I guess you would say, if you haven't tried acupuncture yet and you think you might want to, it's never too late. We have more great guests coming up. Stay with us. Welcome back to our show. We really appreciate you joining us. We're talking about choosing and maintaining healthy lifestyles. My guest right now is registered dietitian Alexandra Coacci. Alexandra, thank you so much for joining us.
Thank you for having me.
So we're talking about inflammation today, and I really want to get right to how does a healthy diet and working with perhaps a registered dietitian help people choose healthy decisions and maintain a healthy lifestyle?
Okay, so the foods that we eat directly impact our body. So our food consumption provides us essential nutrients for our bodily functions, help build and repair our body. When we fill our body with nutrient-dense foods such as whole grains, fruits, vegetables, lean protein, low-fat dairy products, we're giving our body energy throughout the day. We're also helping us maintain a healthy weight. When we fill our body with poorer dietary choices such as a lot of processed foods, a lot of processed meats, a lot of saturated fats. This can promote chronic disease in the body, leading to type 2 diabetes, cardiovascular disease, certain neurological disorders, or certain cancers.
So what kinds of people do you work with, and how big of an issue is inflammation specifically?
Okay, I work with a wide range of patients. So I do specialize in diabetes and renal disease. These diseases can be a result of inflammation in the body over a period of time. Also work with individuals who are just trying to improve their dietary habits from day to day, trying to maintain a healthy weight and prevent these chronic diseases from happening.
So what would cause somebody to come to you as a registered dietitian in the first place?
Okay, most people come to help manage their chronic diseases. So trying, whether that's either trying to lower their LDL or their cholesterol levels, or trying to improve their hemoglobin A1C, which can measure your blood glucose over a period of about 3 months to help improve their diabetes if they are already diagnosed with type 2 diabetes. I also help patients manage their kidney disease. So certain foods that we eat can progress chronic kidney disease. So trying to work with patients to delay end-stage renal disease as much as possible.
So take us through, if somebody comes to you and it's their first time working with a registered dietitian, how do you start? What questions do you ask? What do you need to know before you can plot a path to helping?
So what I look for in patients is I go through an average 24-hour recall, what you typically have throughout the day, typically one weekday and one weekend. Trying to see what they do for a living, how their daily life kind of goes throughout the day. Once I have a general idea of what they're eating throughout the day, I try to find certain ways to tweak what they're doing. Okay, we don't want to start from scratch. We don't want to rebuild what they're doing. We want to tweak it to every little bit can help improve their overall health. So not trying to make dramatic changes too quickly that can lead to restrictive behavior. That restrictive behavior can lead to kind of getting back into these habits.
That's a lot of the reason that you always hear people. I'm sure you hear it because we in the public hear it. Is just like, well, I can't do that because I'm not going to stay, right? I'm not going to start that diet because I can't stay on it. So that's what you're talking about. Not completely starting from scratch because it's an unrealistic goal. Is that what you're saying?
Exactly. Okay. Someone who doesn't eat fish, I'm not going to tell them that they should eat fatty fish because it's high in omega-3 and that's what's good for you. Right. So we want to try to find ways to improve what they're doing throughout the day.
What if someone's just not, what if there's just not enough to work with there?
If there's not enough to work with, then I always like to tell patients, let's focus on a protein, a healthy fat, and a fiber with our meals. These will help an individual stay fuller longer, okay, and better manage blood sugar levels throughout the day.
So can you give people, I think everyone wants somebody to just give them an idea, like what is a good breakfast, what is a good lunch, what is a healthy dinner? That's realistic.
Yes. So I always try to tell patients, let's aim for around 20 to 30 grams of protein with our meal, and always including a fiber source, whether that's whole grains, nuts, seeds, or vegetables. Really trying to optimize non-starchy vegetables on their plate. Those can be lower in calories, higher in fiber, and higher in nutrients.
So let's talk about that. What foods are specifically bad for inflammation and what foods are specifically good for inflammation?
Okay. Foods that are typically bad for inflammation can be refined carbohydrates, such as commercially made baking products like muffins, croissants, bagels, crackers. Also, these can be low in fiber, which can cause sugar spikes, which can cause your pancreas to produce more insulin. It could lead to insulin resistance and type 2 diabetes.
So what are some really good foods that people should be eating to either cut down on inflammation or prevent inflammation?
We want to focus on monounsaturated fatty acids, so that would be like omega-3s. That's found in nuts, seeds, fatty fish like salmon, tuna, avocados, olive oil. We want to try to add at least one serving of these omega-3s throughout the day. And also trying to aim to have 2 servings of fatty fish per week. if you're not a fatty fish eater, which some individuals do not enjoy fish, exploring to see whether omega-3 supplements would be appropriate for that individual, just so they could reach their omega-3 essential fatty acids for the day, or trying to choose more lean proteins that can be more grass-fed animal products like grass-fed beef or pasteurized eggs. These grass-fed or pasteurized lean proteins have been studied to include more omega-3 content in them.
I know a question that comes up is people say like, okay, I know nuts are high in fat, but it's a good fat. I know avocado, the same thing. It's high in fat, but it's a good fat. So what's the balance though for people like, oh, it's a good fat, but it's still high in fat? So like what should you focus on? What is the priority there?
So trying to have one of those servings per day. Okay, so whether that's incorporating some nuts with our oatmeal in the morning or having some avocado on a sandwich. Too much of one thing will never be a good thing. So just trying to incorporate at least one of those servings per day.
And when you're talking about inflammation, what kind of a time frame are you talking about as far as seeing improvement or preventing it? Is it it's not you're going to eat an avocado today and nuts tomorrow and whammo, my inflammation is gone, right? It's not that fast.
Exactly. So sometimes acute inflammation could be a good thing. So for example, we're going to the gym, we're lifting weights, our muscles are sore, our body is trying to repair those muscles. Chronic inflammation can happen over a longer period of time. It could be silent and the body's trying to fix itself, but it doesn't know how to do that. So trying to incorporate these foods throughout the day, so trying to have at least 5 servings of vegetables, two sources of fruit, trying to include whole grains throughout the day and lean protein sources, so we can kind of prevent this chronic inflammation from continuing to develop or developing in the body.
And what about people who say they don't really know where to start? The most impactful, easy switch that somebody could do, especially not a lot, there are some people who just don't cook that often or they don't have time to shop for all these new things. So what are like the top 3 if you're comfortable sharing?
Of course. So trying to layer our food as much as possible. So typically most individuals can have yogurt or oatmeal for breakfast. We don't want to just have that oatmeal or just have that yogurt. So one easy food that we can add to help make this more nutrient dense could be, let's sprinkle some seeds. So flax seeds or hemp seeds can have very little flavor. We can add these to our breakfast or top it off with certain meals to improve our blood sugar levels and help keep us full, and also adds in that omega-3 throughout the day.
Okay, so seeds, that's a super easy fix. So let's talk lunch. You mentioned avocado. Any other suggestions there?
So being mindful of processed meat consumption. So a lot of times we can kind of stir to these deli meats.
Yep.
So trying to be mindful, sometimes having a nutrient-dense salad for lunch could be beneficial. So really trying to stick to the colors of the rainbow when we're having our salads. So a lot of time individuals can just have lettuce or cucumbers or tomatoes. That's typically what most individuals will add. But let's add in some different colors throughout that salad. Let's add in some orange vegetables. Let's add like carrots. Those can be high in vitamin A, which serve as powerful antioxidants. Really trying to eat the color of the rainbow as much as possible.
What about beans? I know a lot of people add like chickpeas and beans also on salads, right?
Chickpeas can also be great to add in our salads as a little bit of a protein source as well.
Gotcha. Okay. And for dinner, you mentioned fatty fish, but lean proteins also. What is something else somebody can sort of super easy make a difference without even really noticing?
Yeah, so sometimes certain dishes that we make at home, like stir fries, we can incorporate a lot of vegetables, a lot of color with our foods, can be relatively very easy. If we don't have accessibility to fresh vegetables with our dinner, frozen vegetables can serve just as great with those meals.
Okay, and your advice for people who have picky eaters who don't like the vegetables, you can sneak them in, right?
Yes, so what I recommend for individuals who typically don't like vegetables is let's make a smoothie. Let's add some spinach in that smoothie. It kind of disguise the taste. The berries or certain fruits that you put in that smoothie can disguise the taste of those vegetables.
Great. Okay. Other hidden tips, suggestions?
Some hidden tips can also be cauliflower rice. Not saying that you have to have a full serving of cauliflower rice, but let's mix half and half. Let's do half regular brown rice and half cauliflower rice. Just a little tweak to add in some vegetables with our grains. That can go unnoticed.
And when you suggest that to people, it's doable for them?
Absolutely. So I'm not telling them to replace their grain, such as their brown rice, with just vegetables. We're kind of just adding them to distinguish the flavor.
Terrific. Really great information and doable. I think that's because people it's like daunting, right? To think you're going to just change your recipes and figure it out. But Alexandra, Coacci, thank you so much. Great information. Thank you to our viewers for tuning in. You're watching Sun 20 TV. I'm Sherry Einhorn. Have a great day.
Funding for Your Health Matters is provided by Stony Brook Southampton Hospital. As part of the Stony Brook Medicine Healthcare System, Stony Brook Southampton Hospital is committed to providing world-class academic-based medical care to our entire East End community.